Hello, I'm Dr. William Shaheen. I'm the Vice President of Akron Digestive Disease Consultants. I've been practicing here for 16 years. I came here straight out of fellowship and training, which was at the University of Rochester in upstate New York. There I was a resident, but also elected chief resident. And then I completed my fellowship there as well. So it's a total of 7 years in upstate New York after graduating from Case Western Reserve University School of Medicine in Cleveland, Ohio. My undergraduate was at Malone College, so a lot of my initial education was here in Northeast Ohio, which is where I'm originally from. Born and raised in North Canton, Ohio, and went to Hoover High School in North Canton before going to Malone College. I chose gastroenterology a little later in the game. I had the initial idea when I was a medical student that I was going to be a primary care doctor in some rural community. But then I did a rotation in gastroenterology and fell in love with scoping, being able to do procedures, being able to help someone right in that moment, stop a bleeding, remove a lesion, remove a cancerous polyp. And I really took to that and instantly said this was the fit for me. So during fellowship training, I trained under an advanced endoscopist, which means I received extra training in doing specialized procedures. That included biliary and pancreas work, which even though is not part of my practice, I still have an expertise in guiding patients to the care that they need for those problems. And in addition, I do work for general endoscopy, dealing with active bleeding in patients who are in the hospital and removing other lesions that we see within the GI tract. And I find that part of my job the most rewarding. I think there's a lot of utility in endoscopy and colonoscopy. We can do a lot of good very quickly and help patients in real time, not just as a diagnostic tool, but as a therapeutic tool. You know, I think what's unique about the way we deliver care at Akron Digestive Disease is that we are a fully independent practice, which means the doctors own and manage the practice, and we make the decisions of how patients receive care. And all of us as physicians are dedicated to the highest quality of care and delivering that care to every patient that walks through our door. And that's something we steadfastly remain committed to delivering quality care in an independent way, that we're not taking any orders or directives from a company or from an administration, but as doctors, we're the ones making those calls.